Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, urgent care. I am affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is very interesting. It is management of lungs disorder, COPD. Joining us today as my guest speaker is Dr. Hawajan Abbas, and she is with the Trinity Health System. She's a pulmonologist, and she is going to share her talk, her expertise with our viewers. So, good morning, Dr. Abbasi.
Good morning, everybody. Good morning, Doctor. Um, I'm happy to be here and talk about the most interesting subject, the COPD.
Yeah, okay. And I'm very lucky to have you because, it is the fall and the winter time, and we see so many individuals, adults or children, with the shortness of breath, lungs problems, emergency room is packed up with them.
Very
So, before I start, can you give us your introduction?
Sure. My name is Hawazin Abbas. I'm a board certified internal medicine, pulmonary critical care sleep. I'm also an interventional pulmonologist. That's kind of my credential. I work with the Trinity Auckland Hospital.
So that's good. It's great to know. So, first of all, we always hear COPD. So, exactly what is COPD?
Very true. COPD. What's COPD? COPD just will go by definition. COPD is a chronic lung disease. Basically, it's inflammation of the lung that we say, most of the patient, they describe it to me, I cannot breathe. The airway, it's narrowed. So if I put it in a simple way, we have a pipe, the pipe is blocked, so we
Right.
cannot get the air in or we cannot get the air out.
Right.
That's
yeah.
exactly what
So
COPD
that is the definition of COPD. So now, working in the emergency room, I see all these people, they are coming, shortness of breath, nurses are triaging. And then I see they are outside smoking. So tell me, what are the risk factors that precipitate COPD in any individual, whether they are adult or senior citizen?
Unfortunately, the risk factor, if you ask me what the risk factor, I would say number one is smoking, number
Right.
two is smoking, number three is smoking.
In all the age group, right?
In all age group.
Yeah.
And number four, definitely there will be another risk factor, pollution, environmental, the
Right,
type of
yeah.
job you're doing, exposed to dust, fumes, and there is a rare percentage that's related to genetic, which we call it alpha-1 antitrypsin deficiency.
Yeah, right.
But
yeah.
if I really want to know what's exactly the risk factor, I would say 80 to 90% of the risk factor is smoking, and smoking.
Yeah, that is right. Smoking, yeah. And then, the consequence factors, like they have, not taking care of their health, high blood pressure, diabetes.
It's add more
So
morbidity,
when
yeah.
I was doing my research, I mean, things have changed so much since we were there. But then the definition of pulmonary hypertension, I got inquisitive. So what is the pulmonary hypertension?
It's a two different subject. If we talk about COPD, it may be related to pulmonary hypertension. But if we talk about pure pulmonary hypertension, it's a whole different subject. It's increase the pressure in the right side of the heart.
Right, that's
And there
what
is
I
so
read,
many
yeah.
risk factor and so many types we can go over in detail.
Right, yeah.
But it's a big, huge
It's a big
subject.
thing.
Very true.
But mostly one of the precipitating factors could be high blood pressure, right?
Yeah,
Okay.
if we divided the pulmonary hypertension into groups, one of the group it could be related to heart disease, and one is
Heart.
related to the lung issues.
Yeah, so that's what, I thought I will ask you about the good thing. So now recognition is very important. So could you comment about the, how What are the symptoms that they will come to you, me, or?
Definitely, that's a great question. So, first of all, how do we know we have a COPD?
Right.
If any one of us we have shortness of breath, cough, productive cough, getting a lot of sputum, getting a shortness of breath with minimum things we do. And this is when I say these symptoms, I'm not saying you have it for a couple days that you have just a regular cold or infection.
Right,
When
yeah.
I say these symptom, it's a lingering symptom. It's going for months, not resolving, getting worse and worse. So at this point, we need to see a physician and ask why we have these symptoms. Because if we go back to the COPD, yes, it's a progressive disease, but it is manageable and preventable. So recognize the symptom is the key for this disease.
Yeah, so most important thing for our viewers to know, shortness of breath, but it could be other causes too. So recognize the symptoms because that's the only way, we can go towards the diagnosis and the treatment.
Very true.
Right.
Recognize the symptom, and as soon as we have these symptoms, it's lingering. We cannot blame it. I have a cold. I have a shortness of breath. Like if you compare yourself to a year ago. So a year ago, for example, I would just give simple example of my patient. She said I was able to walk for 1 block easily last year. This summer come, I'm barely able to walk from my bedroom to the kitchen and fix a meal.
Right.
So that's significant changes in her quality of life, in her shortness of breath. So that should grab our attention. What's happened? Am I coughing more? Am I getting more phlegm?
Right.
So kind of these symptoms.
So that leads to our second question. We want to know about the cough. They are coughing a lot, and whether the cough is productive or non-productive. So how will I will go? I'm going to your office, not the emergency room or urgent care, and those are the symptoms I am presenting. So initially, what do I expect? What kind of test you will be doing to diagnose me that I have COPD?
The first thing for diagnosis, we take a history. We ask about what type, as you said, the cough,
Yeah.
what color of your phlegm, how bad your shortness of breath. Then we put that with a risk factor including,
Yeah.
as we said, smoking, type of job, pollution. Then when we add these together, we go to the diagnosis. The diagnosis is what we call it pulmonary function test. When we
Right.
measure
That
the
will
lung
lead to-
volume.
yeah,
Very
okay.
true. And sometimes we need more testing, like a chest x-ray, a CAT scan, to know what type of COPD, because in general we have two types of COPD.
Obstructive inflammatory.
Yeah, is it emphysematous or is it a chronic bronchitis?
Right.
That's kind of how we start the diagnosis.
So the differential diagnosis depends upon very important factor is sputum. If there is a productive sputum with other symptoms like low-grade fever, chills, and all that, then you go towards the inflammation. But if it is not that, then you go towards the other end, like asthma, COPD,
Very
and
true.
other, which
Yeah.
are chronic.
Very true.
Which
Easy
are
to
chronic.
put it. We call it lingering symptom, not acute symptom. As you said, it's not the fever, the chills. I have it for a week. I coughed and everything resolved. It's a lingering for weeks, months.
Yeah,
So
and
that's
that
what
is
it is.
COPD.
Very true.
So now we go about we did the investigation, we all the diagnostic tests, CBC, chest X-ray, and all that, and then we found it is inflammation, and then we go towards the antibiotics treatment. But no, it's non-inflammatory. Then we go further like chest X-ray, lung scan, and all those, right?
Yeah.
Yeah, so but immediately, when I see a patient, first thing I do is to check their pulse oxy, and then we have the flow meter. So can you explain on that how?
Sure. So the diagnosis of COPD, it's a spirometry, or what we call it lung
Spirometer.
function test. When
Right.
we go there, we see it's a test that measure the lung volume, how much air simply is going
Yeah.
in, how much air is going out, how much air is trapped inside the lung. And you can add, like most of the COPD, they will tell you I'm a shallow breather, which is very true, meaning that they
Right,
can
yeah.
get the air in, but it's hard to get it out. So that's what we call it. It's a spirometry, and if it is, and it also can put what's the severity of COPD in general. Is it mild? Is it moderate? Is it severe? And then based on that, we'll check, as you said, the oxygen level, the carbon dioxide level.
yeah.
There is kind of more into detail.
Which
in
is
that.
more important to know because we want to find out how much is the COT level, whether they are able to expire it or not, that much. So that's good. So then we gave them the treatment and see how they improve, right?
Very true.
Yeah. So later on, can you just comment briefly about the treatment protocol, that recent advances in the treatment protocol? Because before, earlier we used to put them on some antibiotics, but now the treatment has advanced so much. So I want to know from expertise like you, what are the recent advances in the treatment that our viewers should know?
I see. So for the basic, I will start with the basic and we'll talk about the more advanced treatment. The basic, any time of treatment, is stop smoking. That's the rule.
Right.
So you stop the causing.
That is
comes without saying, right? But I know it's hard. It's not easy to give up on smoking. But I would say, what you prefer? Keep burning your lung. No treatment is going to help you.
right.
So after stop smoking, the number 2 is a medication. Now all we know that for COPD there is inhalers. There is 3 types kind of inhalers we used.
Yeah.
And then when I say inhaler, I would divide it into 2. Based on the patient I'm seeing, if I'm seeing an elderly patient with have difficulty to manage and take a deep breath with the inhaler, then we switch him to nebulizer. But in general, stop smoking, inhalers. There is some
Inhalers.
medication, but there is a new thing. It's not a new, but it's been there for years. Unfortunately, we're not very utilize it to the max of it. It's called endoscopic lung volume reduction. When
That's
we talk
what,
about the
when
valves.
I was doing
Yeah.
my research, this is something new that we didn't have it before.
Exactly. It's a trial started like earlier in around
Endoscopy
2000,
lungs,
but
yeah.
now it's FDA approved. It's a part of a treatment, and
Oh.
it should be coming. If you give the inhaler is not working, you should start with the valve. The valve is not the end of the spectrum. The end of spectrum, it's lung transplant.
Yeah.
It's in the middle of spectrum. It simply put it, the valve, it's non-invasive procedure. It's a reversible procedure. It's kind of closing the bad part of the lung and allowing the good part of the lung
Allows
to
the
open.
good- I know.
Yep.
I was curious when I read because so many articles have been reported from Children's Hospital of Philadelphia, even the CDC and all those the recent advances. So that's good. So those are the procedures you will be performing.
Definitely.
Yeah. And then, before there used to be asbestosis, a cause, but now it is gone.
It is gone, hopefully. Or at least we use a mask, right?
I know asbestosis, tuberculosis. That is not, at least not in United States.
We'll
TB
say
is still,
it's still,
there,
it's
but
still
no.
a risk, yeah.
But then, all these things started from 5 years ago with our uncle COVID virus.
Oh, yeah,
That was the time, when the COVID
When the
virus,
COVID, yeah.
I remember I was working at the office and then suddenly everything said, leave everything, go home.
And go home, very true.
Go home because of the COVID epidemic. And then people get depressed when they are home.
Very true.
They keep on smoking more and all those. So now the COVID is under control, but still we have all those Omicron and their sisters. They are all over the year. So now can you just comment on some of the RSV diseases that we are seeing and just a short about the vaccines?
Yeah, part of as you said, the treatment is a vaccine.
Yeah.
If I go back to if I took COPD to the vaccine and COVID, so
Yeah.
after the treatment is the most important part is the prevention. How we prevent COPD flare up.
Right.
Because any flare up and going to the hospital increase mortality.
Right.
So our goal is to prevent that. How we prevent it, as you said, vaccine,
vaccine.
RSV vaccine, pneumonia vaccine, flu vaccine.
Yeah.
Another preventable measure is stop smoking, pulmonary rehab, exercise. This is the most important is keep your
Yeah,
lung
I was going
walking.
there.
Exactly.
Yeah, exercise.
So, like a lung is a muscle, use it or lose it. If you can walk today 10 steps, make your goal tomorrow 11 steps, make it 12 day after. Quality of life, like change
Yeah.
the diet. This is all play a great role to
Yeah.
prevent the disease for progressive, because as we said, it's a progressive but manageable and preventable disease.
Yeah, the RSV has become so prevalent that now when I went through all those vaccines, now they have one brand of Omicron and with the COVID vaccine.
I see.
So they gave it together, RSV vaccine in one and the COVID vaccine in another. And that prevents our population
Very
from
true.
getting more respiratory
Tract
problems,
infection,
right?
yep, and prevent them from going to the hospital where we
Right.
increase the mortality.
Yeah,
So
right,
it's a huge bulk on the prevention, which is, as you said, vaccine, wearing a mask if you know you're going in a
yeah, I
place
was going
where
to
you have.
ask you about
Oh, it's
the-
a huge. I'm a mask person.
You
I
are,
I
huh?
worked with COVID, so I know mask can
Mask
stop
is
so
so
many.
important.
Very important. The season is coming right now. Take your flu vaccine. You know you're going in a crowded place. Just wear a simple regular mask. It can prevent you really from flare up and going to the hospital.
Right, yeah. So very important for our viewers to know that everybody should be updated with the current vaccines.
Very
Now,
true.
there has been so much vaccine
In the market,
dispute.
yeah.
You hear on the news, CNN, and do
Very
this,
true.
don't do that. Yeah.
Very true.
But the bottom line is, I am very conservative. I want everybody to have the proper immunization with a proper vaccine.
Very true.
According to the age, the children need it, adults need it, and especially the senior citizens.
Very true.
Yeah, people who live in the in the senior citizens' home.
Very true. They have already comorbidity, a lot of comorbidity. So adding
Yeah.
another one, it's really make it even worse.
Even more, yeah,
So
right.
if you can take a vaccine after you discuss it with your physician, this is the vaccine, this is the possible side effect, this is the possible complication. I think if you see it in this way, I would
Yeah,
weight
yeah.
it. I would say the benefit way higher
Right,
than the risk,
yeah,
and kind of really advise.
Prevention is better than going through the
Very true.
acute phase,
Very true.
right? You agree
Yeah,
with
very
me?
true.
So then another question I have it in my mind is to ask you about the alpha trypsin deficiency in the lungs alveoli, yeah, because that will take you to the genetic
Type of
predisposers.
COPD. So as we said, the COPD, one of the risk factor is smoking, then pollution and environmental.
right,
And there is a
another.
rare percentage when we call it alpha-1 antitrypsin.
Yeah.
So if I have a patient, let's say young in 50s and 40s, yes, they are a smoker, but a minimum smoking. But when you do the pulmonary function test and a CAT scan, you see a significant changes. These changes didn't come from a year or three of smoking.
Right, yeah,
So should
it is-
raise a suspicion there is something else predisposed that. That's why in middle age, whenever they come with a symptom of COPD, I would advise just check genetic, because the treatment is there and the treatment is different. So definitely we'll measure alpha-1 antitrypsin.
So measure the antitrypsin level, because that will predispose, that will make us think whether is it hereditary, is it cystic fibrosis, or is it some other issues going on. So then we do that testing. So are we forgetting anything else? You tell me, because
No, I just always I say I'm huge with the prevention. Prevention is the key.
prevention.
Stop smoking. That's kind of I don't know how much I can emphasize on stop smoking.
Yeah,
and
right.
please don't switch it to vaping, because that's even worse.
Even worse?
Yeah, even worse. We have the vaping-related disease. So stop smoking. And smoking is not nicotine smoking. It's any type of smoking.
Any type.
Any
yeah.
type. It's a marijuana
Yeah,
smoking.
we did not
It's a-
talk about the marijuana.
Exactly.
How can we forget that?
Yeah.
In this world, we have to
true.
talk about that. E-cigarettes and all
all
those.
this, it's a burn. It's not the nicotine supplement. It's not the marijuana. If you want to switch
Right.
them, take a nicotine supplement. Take marijuana like Audible. But the smoking is the problem.
Right,
So
yeah.
smoking, don't vape. That's kind of the
And the
key.
e-cigarette, I wrote an article about the use of e-cigarettes, the different types they have. They are not that very good either
No,
because the constituent, whatever they are
very
giving.
true, very true. And
So
it can cause way more
no,
damage, especially
no.
for young
Basically
patients.
for the it's not good.
No,
So
it's not good.
so another thing is stay away from the drugs.
Very true.
Marijuana or any kind.
Yeah, just
any
a switch.
kind.
If you use it for different reasons, it's reasonable. But switch. Don't smoke it. Smoking is the problem. It's the burning part.
Exactly. I know, what, Dr. Abbas, couple of years ago, I had somebody like you from pulmonary department I think from the receiving hospital. He brought a full jar, a glass jar full of smokes.
But, oh my.
So he put it on the table. I said, "What is this?" She said, "This is what smoking does.
Yeah, very true.
Fills up the
I wish
ashes."
I know that it's literally I do have a black literal real black lung
Yeah.
that how much damage the smoke can cause
Lungs
for you.
can do.
It's yeah. And the good thing about it, if you stop smoking, it's that some patient, I smoked for a long period of time. It's not gonna matter. No, it is going to matter.
It is,
and it
right,
will improve your lung actually if you stop smoking.
Yeah, you do it for pleasure.
Or
Sometimes
stress.
everybody just like, we have a cup of coffee to please ourselves, have some candy.
Very true.
So what they do, people who are smokers, they smoke. So get the pleasure.
Very true. Sometimes it's just a bad habit. We picked it up and we cannot leave it.
Right, yeah. So now we are talking about the exercise. That is a good way, right?
Definitely. Exercise. There is multiple options for people who have COPD, including pulmonary rehab. In pulmonary rehab, the damages already happened to the lung, so we'll teach you how to breathe by using the lung muscle and the
Yeah.
diaphragm. So it's a kind of
Right.
you helping you more. Definitely changing the type of diet you are eating, healthy. Keep walking, keep exercising. That's kind of things that really help a lot without even medication.
Yeah. So it is very important to be followed by the pulmonary rehab, right?
Very
Okay.
true.
Yeah. So that's very good. We talked about a lot, we still have more things to talk about, like advanced lung disease, like cancer and all that. So maybe in your second segment of your talk, we can talk more in details, what are the procedures that we are doing now, for the emphysematous lungs, how
Very
we
true.
do the lobectomy and all that. So would you like to give a 1-minute keynote advice to all of us about this whole topic that
About COPD.
yeah.
Yeah, it's always remember it's a progressive disease, but don't give up on it. It's a manageable, it's a preventable. Prevention is the key. Stop smoking, see your physician, use your inhalers, do your rehab, do your exercise. And
Yeah,
kind of I
yeah.
cannot emphasize more about smoking.
Yeah, and that is a role of meditation also, right?
Any type of exercise definitely will play
Yeah,
a great
yeah.
role.
Because when you do meditation,
It's inside healing, yeah.
you exercise. So and then when I have a cough and all those things, I go and sit on the sauna. That helps, right?
Yeah, definitely. It's the moisture on the
Opens the
Yeah.
air. Yeah, so that's good. So I'm so happy to have you on my show today.
Thank you.
And I like to and 1-minute advice from you and from me is same. Change the habit
Very true.
of your eating, eat well, nutrition, do exercise. And what I tell our senior citizens, just take a walk.
Very true.
Because walking is a very good
It's
exercise,
very
right?
true, yeah.
Yeah, and don't forget what you said. Wear a mask.
Very true. Wear a mask. I'm a mask. I can have all about mask.
Yeah,
Especially
we-
now the season is coming. Don't go crowded area.
Yeah,
if you don't
this
need
is,
to.
now the schools have just started, and I know we will be seeing all those kids, they come home
Very true.
Yeah, the allergy to pollens and,
Oh, yeah, very
another thing now there is
Yeah, very true. It's a
one
perceived
after
thing.
another, and associated with all of this is the hidden COVID type.
Very true, yeah.
Omicron has divided and so many times, and
So many type of virus we have. Yeah.
yeah, so that's good. So I like to thank you for coming to my show, and I like to thank our viewers for watching me on my health talk with the guest speaker, Dr. Abbas, and she is a pulmonologist with the Trinity Health System. And until I see you guys again, have a very safe and a wonderful fall and winter. Thank you again.